You are listening to Lovesick, the podcast, where we dive into health, wellness, and relationships and their impact on the world. Come be a part of the discussion and join our community by following us on YouTube, Instagram, and listening wherever you get your favorite podcasts. Enjoy the show. Hello, everyone, and welcome back to the Lovesick podcast. I am your host, Jada, and with me I always have
Michael
and
Dorothea.
And today we have a very special guest. He needs no introduction. If you are alive and well in the world and you know TV or relationships or health or love or addiction, we've got Dr. Drew in the house. So hello, Dr. Drew. Welcome.
Welcome.
Any of those crazy topics. I'm up for it.
Thank you so much for joining us. I want to say my first introduction to you was I was in middle school, so I was very young. I was in middle school, but I was watching Loveline on MTV. And the thing I found interesting about that show, and again, this is like my 12-year-old brain, so obviously later on it still has an impact on me, though, is a lot of stuff we cover is love and relationships here and anything from sickness and illness and disease and stuff. And I think that show was super amazing, and you guys really diving into these, like everyone's sets, problems, issues. And it was really fascinating to me just because I didn't know the lengths of, again, being that young, but in hindsight, looking at it again, the lengths of people who were affected by what their partner does or even stuff within themselves if they have an addiction or an issue and how it can, ruin a relationship, basically.
Right. So that show really started on radio in 1983. Yeah. And the reason I was doing it was I was deep into treating AIDS patients at the time. And nobody was talking to young people about what we just started calling HTLV3. We just stopped calling AIDS grids. And literally no one was talking to young people. It was bizarre. And one Anthony Fauci, who was somebody I admired greatly at the time, was encouraging us younger physicians. We had to go out there. We had to go out there and educate. And it was considered bizarre to talk to young people about reproductive health and sexual health. You have to imagine that period of history. It was very different. And so as we went on, more and more sort of stuff started coming our way. And then MTV, we went on television. And I worked, I'm an internist, but I worked in a psychiatric hospital for 35 years. And we went through in this country some sort of period of extraordinary, really childhood adverse experiences. I mean, like for about 1960s, 70s, 80s, maybe into the 90s, there was almost a pandemic of adverse childhood experiences. In fact, I've got a book sitting in front of me. A friend of mine wrote this. This guy is a social psychologist, was on faculty in Cambridge, and it's about his life as a troubled kid and how he found his way out. But the point is that, when it comes to relationships, whatever injuries we had in childhood, whatever psychopathologies we have, they always get acted out in our relationships. That's where the crazy really comes out, is in our relationships.
Yeah, and more so than anything else, right? I think romantic relationships trigger you in a way nothing else can.
That's right. Mm-hmm. That's exactly right.
And I think a lot of times we think we have it covered until we get there.
Yeah, no, it's whatever residual, and everyone's got something, right? And so whatever residual from the emotional landscape of our attachments in childhood, that necessarily gets acted out in our very, very close romantic relationships, where all that is represented yet again, and we're trying to navigate it, and we don't realize it's all on a very deep level. We don't have a lot of conscious awareness of these things, who we're attracted to. I mean, the thing on Loveline, more than anything, we were talking about broken pickers. People, why are we attracted to that kind of person? It really is not so much that, well, there was a certain amount of acting out, addiction, all that kind of stuff too, but as always, but really the recurrent problems were, why that kind of guy? Why that kind of girl? Why did you do that again? And people had a hard time back in those days understanding that those patterns come from trauma.
And a lot of people don't have I think also it's things now, like as far as like mental health and things have been more accepted, like we said, and I feel like there's more help these days. So we start to normalize some of these things where before it may have been pushed under the rug or it was like a social thing. I can't talk about this with anybody. And so I think that, that was a different time to definitely have to, see it from a different perspective. So I think hopefully now people have more resources and stuff that they can,
And
access.
even though the resources are there, though, people are as defensive as ever, and we don't like to, we don't like to see these things, and our brain is configured in such a way. The way trauma works is it cuts off that part of ourself that was traumatized. I mean, literally, what people who've been through, and again, you mentioned previous times, we're at least now trying, we are at least have an adverse childhood experience scale, and we understand, and on that scale is divorce and abandonment and someone with an addiction problem and domestic abuse and all the things that are so common in this country. These things, you have 2 or 3 of those on your childhood scale, and your risk of mental health issues are really skyrocket at that point. And of course, in relationships, that's where they come out, as we said. But what happens with trauma is the brain goes, okay, well, I have to survive it. And the way you survive it is you literally, the brain actually unwires itself and cuts itself off from those experiences and those parts of the self. And yet those parts of the self still need attention. They still demand attention. They still will create behaviors, even though you don't know where they're coming from. And the conscious experience is, I dealt with that. I don't worry. I don't even think about that anymore. It's not a problem for me anymore. Oh, but it is. Some of those choices you're making, some of those situations you get in, some of the ways you behave in those situations, that's that leftover part of yourself you have to find a way to access. And yes, you're right, Jada, there's a lot of new treatment available to help people access that. That's pretty efficient. Back in the day, we'd have to do emotionally focused therapy, and it would take years. Now we have things like EMDR and whatnot, various other techniques that get us into those areas much more quickly.
Yeah.
Yeah, to that, I guess, Doctor, Drew, you've been on the front lines of this, and you've watched this transition, I think, of society up close and been a active participant, living a public life over the last 30 years. I think you and I both have watched very publicly how the perception of things has changed, and it's interesting. The openness has happened, but there's also a lot of closed off of communication. But for you, what are the biggest things that you see now, or that you wish we were talking about more?
Well, oh boy. We're we're both more open and more aware of mental health issues, but we've gone 2 directions simultaneously. We are using mental health as excuses for things, or as ways to dismiss things, which is not the point. At the same time, we are not providing adequate resources for people to actually do something about these things that they have some awareness about now and have a language to discuss and sort of a common discourse about it. But we are woefully understaffed in terms of psychiatrists, and particularly, and also psychologists and other therapists. And even if you have those professionals around, who has the money and the resources and the time that it takes to do these things? And at the same time, I said there's underrepresentation of psychiatry. We're also overprescribing psychiatric medication, but that's primary care medicine doing that, and at the same time underprescribing in certain populations. So
Right.
it's such a mixed mess right now. I have all kinds of sort of my feelings are mixed as a result. Like, we've made so much progress in terms of our ability to have a common language about these things and to understand it and to talk more openly about it. I think the fact that people talk about stigma is kind of odd to me. No one ever complains about stigma anymore. And yet there's all this, oh, yeah, reduce stigma. It's like, look, you can go to online therapy now, and you don't have to even turn your camera on. Where is the stigma in that? I mean, you have access without stigma. There's resistance. There's just resistance, and resistance is normal in psychopathology, and we have to sort of overcome that. And by the same token, we can't. This is what bothers me. Just because we can talk about it doesn't mean it's over or it's done.
Right.
That's the part that's really problematic. I mean, I was a patient in therapy for 11 years. I had a little sort of some big T trauma in my life and stuff. It took forever to work it through. I understand it takes a long time. It's forever. But you can't, I knew about what the issue was for a long, long time before I had processed it properly.
I mean, you have to want to do the work.
Right.
I mean, that's the biggest thing. You can go see somebody, but yeah.
You have to show up. I don't know about wanting to do the work, because I used to complain about this in therapy all the time, because I would go, well, I'm here, I want to do the work, but I don't know what to do. I don't know how to do it, because that part of my brain isn't working. It's
Right.
literally like taking somebody who's never walked before and go, okay, now walk. It's like, Well, I don't know how yet. It
Right,
takes
and
time to sort of develop those pathways.
and
Right.
relearning some of it too, right?
Oh my
It's
God,
like
unlearning. Yeah,
it's like
relearning,
unlearning it
unloading.
and then relearning
Yeah.
it, and like learning how to walk, but you were walking wrong, right?
Yeah.
Like right?
Oh man, that's the worst.
Right? And you're like,
It's the
I
worst.
kind of think I know how to do this. No, don't run like that because you're going to run into something hard.
That is vivid and absolutely 100% true. That is precisely the point. And so we got more work to do. The point is, as always, I would hope that people would adopt a sort of I would like to see people develop a positive mental attitude on all these things. There's so much negativity and there's so much negative aggression acting out and stuff. And Voltaire at the end of Candide said, in French, il faut cultiver nos jardins, which is, look, it's important that we just each cultivate our own gardens, meaning
I
that
love
we
that.
really take care of ourselves, our family, our community, and don't get out there on Twitter and worry about everybody else.
Yeah.
That is acting out behavior. And I understand it's gratifying, I get it, it's interesting, but we really gotta, you look at every great epic poem through history or whatever it is, when the heroes finding their way back home, they're like, "What did you learn, sir? What through your travels, Gilgamesh? What happened?" And he just I decided I got to come back and serve my community. That's
Yeah.
it.
Right.
There you go. There you go.
Well, and we were learning a lot of technology and a lot of communication skills, and then we're learning terminology so we can use it as weapons. Like that's one of the things that's
You
mind
are
blowing.
so
That's huge.
right,
Yeah,
Michael.
that
You're
is so
so
big.
right.
Like how we take mental health stuff and then turn it into a weapon, and everybody's a
Ugh.
narcissist,
Mhm.
and we're
Ooh.
gaslighting, and every
Well,
conversation we
yeah.
don't like is suddenly a trigger or an abuse or an
Right.
attack. It's like
And let me tell you
feels that
that
way.
you're so right. And the over deployment of jargon, right? So everyone jargon. And I, having again, worked many tens of thousands, hundreds of thousands of hours in a psychiatric hospital, I see each of these terms as non-pejorative in the sense that if somebody's a narcissist, that's just their makeup. And if I wanted a fighter pilot, I want a narcissist.
Yes.
That's who I want. I
Yeah.
want that guy.
Yeah.
And so that it's not bad. Now, if you're in an intimate relationship with a malignant narcissist, that's not going to be so pretty. And you got to understand how that works. But damn, I want that guy on the front lines. And so none of these things are all bad. None of them. I mean, I believe that alcoholism and addiction, that genetic predilection, is a feature of evolutionary heritage. Those people are great survivors in extreme adversity.
Mhm.
Not when they're using, of
Mhm.
course, but when, just that genetic makeup seems to
Right.
carry with it this huge survival potential. That's why it has stayed so steady in the human genome throughout human history. It's caused a lot of destruction. It should have burned out of the genome. Stayed very steady. Has adaptive advantages in extreme circumstances.
Yeah.
I'm sorry. Dr. Drew, I have a question for you
Yes, ma'am.
on the patient side, because I do have an illness. I have pulmonary sarcoidosis.
Oh, goodness.
Yes, I have pulmonary, and I've had it actually 42 years or so now. I do get a lot of people, because I am an advocate. A lot of people, when we talk about relationships and having an illness, most people come to me and say, how soon do you tell someone when you're in a relationship
Yeah.
that you're sick?
Right.
Or
Yeah.
my
Yeah.
husband left me, my partner left me because I'm sick. So what do you suggest in reference to relationships and timing to actually tell someone that you have an illness?
Huge topic. Huge topic. And I'm sure you've discussed your sarcoid. And
Yes.
it's non-caseating granulomas. It's
Yes.
relatively slow and relatively benign, but it can cause trouble and it can
Oh,
be a pain in the
yes.
neck.
Mhm.
And but good. I mean, it's it's the kinds of there's certain illnesses that if you have to get a bad illness, that's one of the ones you don't mind having. I have
Right.
prostate cancer, and it's like, if I got to get cancer, good. That's the one I want.
Right. Right.
But in terms of when, of course, right, you're really talking about new relationships, right, Dorothea?
Yes.
Yeah. You don't want to hit somebody over the head with it. right? You want somebody first to get to form a connection with you of some type. And now you don't want somebody to get bonded with you in such a way where they're going to feel resentment that you didn't tell them, like they feel as though you've hidden it from them. It's not that you're hiding, it's just we used to Corolla, back to Loveland, Corolla used to say, more mystery and less history. You don't want to lay it all out there, although you have no obligation to do that.
Easy. Let me like you before you tell me everything, right?
That's right.
Because there's all stuff. We all have stuff.
Yes.
Are we going to have a second and a third date? Is this
Right.
going to happen? Yeah.
Right.
And it also depends on the seriousness of the illness, right? Now, a mild one, you might want to come right out of the gates with, like, look, I've just been passing and I've had this thing, it doesn't bother me anymore. It's the thing I have to get checked up once in a while, but fine. But if you have something that's going to progress or needs care,
Right.
that is, man, that
It's tough.
yeah, it is tough. And I'm trying to think. You have to. Part of it is I'm trying to put myself in your shoes, and I'm thinking,
Right.
if I had a serious illness, the one thing you wouldn't want to do, I imagine most people would not want to do, is to burden somebody else with that illness, right? You don't want to
Absolutely.
feel like a burden. You don't want them to be scared of whatever this thing is. So it really is about education, I think, of the individual, and clarity about God. It's like having kids, or like needing to move, or having a career that takes you away. Look, relationships are messy,
Yes.
and if it's a terminal illness, I mean, if somebody wants to get involved with that, they're taking on a lot.
Yes.
If it's a chronic illness that might progress and require care, I think second or third date is kind of being open about that. Like, there's something that might be involved here. And if that person really is into who you are, they might take that on as part of all that. But if it's something mild and, of course, people are weird about all illnesses. Dorothea, I'm sure you found this, because a lot of
Yes.
people never heard of sarcoidosis.
Right.
Ooh, what's that? It
Right.
sounds
Oh,
spooky.
I
It
get
sounds
that.
weird.
I still get that today,
Yes, she
believe it or
does.
not. People will say, you don't look sick. And I'm thinking, well, what does sick look like? But you don't know what the inside of my body looks like.
Yeah.
That's right. I would think the milder stuff I would come out with relatively early, I think, and then really work on educating after that. Like, I'm telling you, because by the way, they have to, because part of this is trust too. Like, you're building trust
Exactly.
as you develop openness, and part of that trust has to be, I'm telling you, this is mild. You're gonna have to trust me on that. It is mild.
Right.
So it's different for different diseases. And then you mentioned in your question, what about people leaving somebody because
Oh,
of it?
yes. Yes.
And that's heartbreaking to me. It depends on the relationship. I mean, look, if it's a 28-year-old in a 6 months or 12-month-old romantic relationship, I get it. People leave.
Right.
But if it's a 20-year marriage, then it's like, sickness or in health, honey.
Right.
Sickness
Right.
and health, man.
Exactly.
That's what we signed up for. And so I am a huge believer in commitment.
Right.
And there's theories about love, and in this one triangular concept of love, commitment is the top of the triangle, and we have like minimized that piece. And I've been with my wife for close to 40 years, and it pays dividends. And guess
Right.
what? Yeah, we talked about patterns earlier. If you leave a relationship, you'll go do the same thing again. It'll be the same kind of person. You'll do it again. You might learn a little bit. It might be a little lesser of what you did, but it'll be the same kind of thing.
But you're going to take you to that relationship.
You're taking you and all your old patterns.
Right? So
And then that person
Right.
could have something else that you have to sit there and deal with as well. So it's a
Exactly.
whole other
That's right.
thing. Yeah.
Yes.
we very much have this grass is greener kind of view, especially in relationships. And I agree with you. Like, commitment is something that people, it's almost a dirty word now. It's like a word that's not on the
Dirty
list
word.
when we ask people. Like, we ask people about
Right.
First date, do you want to get married?
we'll ask people
Oh, boy.
about, do you want to
Oh,
have
boy.
children? And we'll ask people about, like, we ask people about their jobs. We ask people about all of these things that, like, your job's going to change, because most of us
Yeah.
have had
Right.
to change along the way.
Yeah.
But how committed are you, and what do you really want out of life? Most people never ask
Yeah.
those questions.
Right.
Ooh, it's a big one.
Yeah, and because many of us have been abandoned or come from ruptured family systems and things like that, We don't trust commitments. We're always, got one foot in the exit, or at least the exit's open for us because somebody did that to us. And you really have to kind of work on that. And, back into the therapeutic setting, that's why I'm a big fan of long-term relationship with a therapist, because that's where you learn to trust somebody and build wide openness, deep openness, that person then becomes a kind of attachment that you can then translate out into the world.
You said something that I want to highlight just for a second, because you said, I have prostate cancer.
Mm.
And if there's one you're going to have, that's the one you want.
Yeah.
And I think that terrifies a lot of people. And I've almost never heard a man say that.
About prostate cancer?
Just
Let's come. I'm a physician. I know how bad it can get. And
Right.
This is what we can do a lot with.
Right.
And it because it involves your sexual organs, men get weird about it.
Right.
But trust me, you can be just fine after all the various treatments we have for prostate cancer. I mean, if you get metastatic disease, and by the way, I do want to say I work with an organization called the Prostate Cancer Foundation, and we are trying to create initiatives to help Black men. African American men have a higher propensity for prostate cancer. The disease is further along at the time of diagnosis, and it tends to be more aggressive disease.
Wow.
So please, everyone, get your PSA. If you have a first-degree relative, start at age 40. If you no one in your family, start at age 50. We can do so much with this now. So anyway, that's my public service announcement.
Well,
I love that.
No, I wanted it.
Perfect.
That's kind of what I was
Yes.
hoping for, but also I love how active and open you are about it, because I think that goes back to Dorothea's point, is like,
Right.
everybody's fighting something. This is one of the things about being in a long-term committed relationship, right? Is you have a support structure. You have someone who's going to walk that battle with you. And I think that's so
right
good for mental
person.
health.
The right person.
And it's interesting, my wife had I didn't realize how threatening it was to her. I knew it was upsetting to her, and I always thought, well, she doesn't get it. This is, it's the word cancer, and I know what prostate. I know the different kinds of cancer. I know this one is going to be okay.
Right.
But she didn't. Not just that. She was like, what about our relationship and our sexuality? Blah, blah. She was completely threatened by it, and I didn't appreciate it. So, by the way, as the sick person, you have to also be sympathetic and empathetic for the partner. You can miss it, because you're busy focused on you and your illness.
Right. Exactly.
You brought up an interesting point about, the stages of when you tell someone about your certain diseases and the easier ones. Because, I think because we're learning more about things being more common stuff, I think if I was on a day and I was like, I have diabetes, I feel like someone's going to be like, okay, so you're not going to have sugar. Like they think, you have a little bit of an idea of what that is about. But if you say I have sarcoidosis, it's like, whoa, hey, I don't know what that is. What does that mean? And it can be scary to another person.
And there are, I don't have my textbooks in front of you, but there are textbooks I can pile to the ceiling with all the different illnesses that humans get.
Yeah.
And you've never heard of 99% of them.
Yeah.
You've never, and so we have a weird, in Western culture, I have a tendency to shut illness behind closed doors. Death and dying is out in the hospital somewhere. It's part of our experience. We're biological. Shit happens.
Right.
That's us. That's
and you just have to accept that's part of it too. Is if you think we've had this conversation. If you jump to a new relationship, if you expect that person's never going to have anything,
oh no,
they may get something far worse than the person that you left, right?
Like then what? Or you might then at that point,
and you're going to get something if you live long enough. We're all going to get something, and I think that's part of it.
It's nuts.
Going back to the mental health aspect for a moment.
And then I got to leave in like 2 minutes.
Okay.
Guys. I'm so sorry about that.
So, no worries.
Go ahead.
One of the
Mental
things
health.
you mentioned, over prescription.
Oh yeah. Terrible.
And I know it's a huge issue for you. Maybe that's a good place for you to kind of give us your perspective as you close of what you wish people knew and what you wish they did different.
All right. I'm going to keep it very simple. I should come back and we'll do more on this topic. Okay.
Please.
Which is, I was raised by an old family practitioner who always hammered into my head that medicines are dangerous. Medicines are dangerous only when the risk is worth it. It's absolutely worth it. I never took an antibiotic till I was 15. And I remember when he first gave it, my pediatrician ordered it, my dad brought some samples home. And I remember I was standing in the kitchen. He's like, all right, here we go. We'll see what happens. You're going to take an antibiotic. Like, it's like, we're crossing over a line here. I mean, it was that big a deal to him just to take some ampicillin. And And we have completely lost track of that in this country. Medicines are only seen as good, only things, expectation of making things better. All medicines are dangerous. All medicines have downside, even when they help. And so it really, the risk reward has to always be contemplated. And so, I spent a lot of my time running around the psychiatric hospital dealing with the medical consequences of psychotropic medication. Tons of it. There's stuff can happen. My greatest concern is that people come in. When Sigmund Freud arrived on these shores, a reporter put a microphone in his face and said, "Dr. Freud, what do you hope to accomplish here in America?" And he said, "Well, I hope to come to a deeper understanding of the difference between bona fide mental illness and ordinary misery." We have lost track of ordinary misery. Ordinary misery is how we develop resiliency and grit, and we can develop exercise and dietary and sleep patterns and all these other things we can do to help ourselves, to build ourselves in response to misery, as opposed to going, "I am miserable. I need relief now. I need a pill to give me relief." Now, if somebody does have bona fide illness, I am a big fan of the medication. They do work. My concern is the massive prescribing is done by primary care doctors, and they are literally not trained to do it. They do a lot of it. They are not trained to do it. So if you have a bona fide mental illness, which are common, 20% of us or so have at any given time, fine if your primary care starts the treatment. I don't mind that, but please get a consultation with an expert, a psychiatrist, and B, also ask your primary care person if you can come up with the resources and the time for a referral to a psychologist or an LMFT or a therapist. So you're doing both. And the goal would be to get off the medicine as soon as possible. And there will be side effects. There always are.
Right.
So there you go.
Agreed.
Awesome.
Thank you so
Thank
much.
you so much,
Dr.
Dr.
All right, guys,
Drew.
Please
thank
come
you.
back.
Please
We
come
got so
back.
many more questions. It's been
Done and
wonderful.
done.
Talk to you later.
Thank
Thank
you, guys. Will
you.
do.
Have a great day.
Bye-bye.
Bye.
That was love it.
Incredible.
Incredible.
That
And
was great.
that's really, for me, some of those, he did it in such a succinct way. And I hope he comes back because
Same.
because I think we need to touch each of those topics a
Oh,
little
yeah.
more.
100%.
But what he said, we've talked about this. It's one of the things why we keep trying to come up with alternative medicine and natural resources for people is every medicine has a side effect. Every medicine has an impact on you. We are all very unique chemistry sets.
True.
And the minute you start playing with it,
Yeah.
and I think we have become a country where it's just like, oh, there's a pill for that.
Right.
Oh, we can
Pill
fix
for
that.
everything.
Yeah.
Right. Yes.
And the truth is, a lot of it just masks stuff. That's not
Right.
really solving the problem. And what he said, I think, is really valuable. Is
It's like a Band-Aid.
it's a
Band-Aid.
and it's
Put the
you're
Band-Aid
covering
on.
your misery,
Right.
Right,
Exactly.
as opposed to facing the thing and letting it build the resilience in you. And listen, no one likes to go through horrible stuff.
No.
Nobody wants to grieve. Nobody wants to. We've talked about this both publicly and privately. It sucks.
Right.
There's lots of times you don't want to have to deal with an illness,
But
but you
I
also
am.
didn't. But
Right,
you
you're
didn't let it
dealing with it.
define
You
your
gotta
life,
sit
right?
in it though.
Right.
I think a big part of it
No,
is
you're
just like
right.
sitting in it though, and
Yes.
knowing and realize, just like with grief and stuff, it's like sit in it. It's happening, but you need to do yourself a favor
Right.
too, because if you keep putting band-aids on it, you're only going to make yourself
Right.
sicker or more or
And
masking
even
your pain
mentally,
or
you're
mentally,
gonna
yeah.
be getting something else because
Yeah.
Well-
you're like stressing about
Yep.
it.
And yes, this is a disease that
Mhm.
you face all
Yeah.
the time, right?
24/7.
But
Yeah.
it also isn't the only definer of your life.
Exactly.
And it really has shifted your life in a lot of ways. And it's very interesting how you've taken that. And a large part of the show is how you've turned that into empowerment. And I hope that our listeners, our viewers, I hope everybody kind of gets that and can be inspired by that, because it's one of the things
True.
I admire about you so much.
Oh, thank you.
And, you talked about your 5 a.m.s, right?
Yeah, still doing them. Still doing them, everybody.
mental
5 a.m.
health
mental health time.
aspect,
Yep.
That's just as important as any medication that one would
Right.
take.
And it actually, believe it or not, I believe at this moment, it actually made me healthier
Yeah.
because I was more conscious about now what I put in my body and just making sure I get the physical part and then the mental by not really thinking about it 24/7. So it has changed me for the better.
Yeah, I think
So,
I hope
yeah.
our audience hears that. That's, to me, hear that. Hear the power of someone who literally has been fighting this for so long.
Long time.
But the truth is, you can become stronger on the other side of it.
Yes.
And that's the part.
Yes.
You don't have to feel alone.
No.
There are other resources. And,
Mhm.
like Dr. Drew said, we're going to carry we're all going to get something,
Something.
and man, to hear him say, I have prostate cancer. I'm glad I got that one.
Yes.
That is
was-
not something
yeah.
you hear a lot. And it was so powerful.
It was very powerful.
Because people are so down, but he says, hey, if I have to have the big C, I want that one.
Because I know how to manage it.
Because I know what to do.
Yeah.
And maybe it's good that people do hear that and is thinking, okay, well, maybe I should go get my test now.
Get tested.
Because Dr. Drew said, you know what I mean?
But get tested. I think
Yes.
I went earlier to get my colonoscopy before my date of age 45. And I just
Right.
think it was very important because, it's like they pulled a precancerous cell out and it was like, wow, if I would have waited
Mm-hmm.
X amount of
If you
years.
had followed the literature
Yeah.
or followed
Yeah.
a blank number,
Right.
Yep.
right?
Mm-hmm.
You could have been 2 years into a much bigger problem,
Right.
Yep.
as opposed to 2 years ahead
Right.
of preventing
Yep.
something
Yeah.
massive. And
Agreed.
that's a life changing,
Absolutely.
and it's family changing.
Yeah, of course.
Right? Like this
of course.
is world changing.
Yeah.
The
You have to
world,
be
your
proactive.
world, your children.
Yes.
And I think that's a huge part of, I love having him on for that reason. He's such a
He was
wealth
great.
of knowledge.
Oh my gosh.
That's
I
amazing.
could have listened to him.
Me
for
too.
another-
I know.
for another hour or so,
Come back, Dr.
Just-
Drew.
Yeah, okay.
Come back.
I think we're holding you to that.
Yes, come back.
But also for our audience, this is where the conversation I hope grows is it's okay to share these things,
Yeah.
Right.
own them.
Yep.
It's super brave to tell people, oh, I went and did this.
Mm-hmm.
And so many people will hide that.
Oh, yeah, of course.
But
No,
the
I think
truth
it's-
is we all have to go get checked and tested because we're exposed to so
Right.
much more. There's so many more environmental factors than there used to be.
Yeah.
Right.
But
Yeah.
also,
I
there's
mean,
so
nobody
many
loves the
different
test
things.
and all that. I mean, like last month, I had to get a CAT scan, and thank God everything came back great.
Yeah.
I mean, it all reflects my illness.
Right.
So it's like great in that way. It's
Yeah.
nothing that's new
Right.
or whatever, but it's very consistent for what I'm going through. So in that case, I guess it is great because it's nothing different or changed. But you just have to go and you just have to see how you're doing, the updates, because things can change.
And with technology, too, it's like if
Yeah.
you go get pre-screened for
And
things,
you have to. And
Yeah.
and Jada knows that I do not like CAT scans or MRIs. Like I do
the
not.
closed ones.
I'm
Ugh, I
I'm
can't
very
stand those. I
claustrophobic.
can't stand those ones.
I am literally claustrophobic, and I had to talk myself into it, honestly.
Right.
When I got there at the radiology place, I literally had to sit there and talk myself because I didn't want to take that pill. Sometimes I would say I need that pill
Right.
so I can relax to go through the machine. But this time I said, I'm going to face this fear.
Mhm.
I'm not getting a pill. I want to talk myself through this and I'm going to just go for it. And that's what I did. So I finally faced my fear last month
Nice.
and said, okay, Dorothea, you can do this. So when I got in the room, I did get a little bit of anxiety.
Yeah.
I mean, I said, oh my gosh, what am I doing?
Yeah.
But then I did tell the technologist, I said, listen, bear with me just a few moments because I'm starting to feel a little bit of anxiety and I just need a moment. And she was fine. She says, not a problem. Just let me know. And then I finally said, okay, let's go. And that's what happened. And then when I got up, I was like, oh my gosh, this is like great. But then the funny side of it, I'm thinking I'm done. I'm like, yes, I did it. And then she goes, oh, well, your physician wants you to flip over.
Oh no!
False advertising. Hold on a minute. Wait a minute. I just got my. Okay. If you want to
Yes.
talk about a divine test, every time you're like, okay, I got this.
Right.
And it's like, oh, you think you got it?
Yeah.
Okay, well, there's this extra piece, right?
Right,
But but how beautiful that you literally
Right.
said, I'm going to face it.
I did.
I can't stand those MRIs.
But, right.
I have
but
to
I
get them
wasn't
once a
good
year.
with the flipping over because then I said, why do I have to flip over?
Yeah.
Like I'm thinking, I just got through all this. Why do I have to flip? Well, because he wants to see
Oh.
the other angle also.
Did you have to take that?
Not to die.
Oh, okay.
Not
That
the-
dye
not the-
stuff is
Listen,
so
the
weird.
dye is gross,
Yeah.
and then
Yeah.
there's something really eerie
Yeah.
about laying face down in one of those.
Yeah.
I
Yes.
had to. Can you imagine?
Oh, no,
And I'm
I've
already
done it.
How
flipping.
long did you have to do it for?
Just-
Even 2
I
minutes
think
feels
it was like it felt like it
45
was
hours.
longer than like 5 minutes or so. But when she said, "Oh no, you have to flip over because he wants to get
Like,
the
hey,
backside of your lungs," and I'm like, "What? I just went through the front,
Right?
No, he wants to see the back too." And I thought, "Oh my gosh!" And when I got on the table and they had a pillow, I just couldn't get it right. I said, "Wait, I need to move this pillow," and I'm like, "No, I need it back." And I said, "How long?" I said, "Can we hurry up because I'm feeling like I can't breathe on my stomach."
But then it's like if you move around too much or
They said-
something,
Yeah, they're like, don't move.
then you
Again.
can't. Then you have to come back again
Yeah.
because
Yeah.
I had to go do the same thing.
Yes.
And I did one side, and then they had to put that stuff in me. The one side was like 8 minutes. I was like,
Yes,
yeah,
that
8
died.
minutes. And then the next
Ooh.
one they were like 30 whatever minutes, and I was like, are you serious? And then you literally like, what if I get stuck in this thing? Like I just I try to close
Everything.
my eyes,
Yes.
sing to myself. Like I don't know.
They said, "Close your eyes and act like you're on an island or something." I'm like, "No, that's not
Yeah.
working."
Listen, that thing sounds like bum bum bum
Yes.
bum 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 bum. It
Yes.
sounds like
Even if
somebody's
they put those headphones or whatever on you, you
I
can
can't,
still
yeah.
hear
pretend
that.
you're on an island. No,
Oh my gosh.
that doesn't work.
No.
The island does not sound or look like that.
No. And they were like, "Well, close your eyes," and I'm like, "I need to close my eyes before I go in.
Yeah.
Yeah.
I can't wait till I'm there to close my eyes because I'm gonna freak out, So
I've had special experience in the MRI machine. I've been pretty healthy, but I did have to get a huge CT. I was involved in an accident, and they put a collar on you and then strap you down
Oh,
my goodness.
No,
and
no
slide
way.
you in.
no
Nope.
way.
And then
I wouldn't have been able
wait,
to do that.
45 minutes
Oh,
on
nope.
each side. And,
No.
and
On
guess
each
what?
side?
Oh, well, hold on. It gets better. Plus contrast.
Oh
Nope.
no.
And then we had a power outage.
Okay.
So I had to start over. And I was like,
no.
is this a sign? I'm like, is
No.
this?
No.
So what I will tell you is, I just go to sleep in MRI machines.
yeah.
And my joke is they literally tell me, will you stop moving? I'm like, yeah, no problem. Between all the kids and everything, we've had a ridiculous amount of scans.
right.
So I'm lucky that I don't have, that I don't get worried about tight spaces or things like that.
Right.
But part of it for me is like, I go into the mode that you went into is I'm going to make this work.
Mm-hmm.
I used to be a high rigger. I used to rig stuff off of buildings and off of the sides of stuff. And I hate heights. But I
Me
always
too.
took the job that I was afraid of.
Yeah.
And Jen and I have talked about
man.
it. So like for me, I'm like, okay, I have to make that work.
Yeah.
Mm-hmm.
So I'm gonna have to face it, right? So when they're like, okay, somebody's got to go 60 feet up on top of this, or
Right.
somebody's got to go 80 feet and then hang off the side. I'm like, that's me. But that's the
Right.
funny part. And
You're
everybody-
facing those fears. I
because
like
I'm
it.
like,
I like
people
it.
are like, oh my God, how did you do that? And I'm like, I had to make the decision. To me, I take it as this is an opportunity for me to change that
Mhm.
path.
Yeah.
Just same as you did. You said,
Right.
I'm not going to let it be that this time.
Right.
I'm
No
gonna
pills.
do it different.
Right.
No, and I love that you didn't do the
Yeah,
pills.
no
Yeah.
pills. I was contemplating though. I swear I couldn't sleep.
And then they
That
say flip
night.
over.
And then when they said, I'm thinking, "Oh, hallelujah, I made it."
Yeah.
And I'm getting up and she says, "Oh, no. And that did it. Then I went into that anxiety.
Well, here's the
mode.
thing.
Yes.
I think all things aside, mammograms, MRI,
Ah.
all the things
Yes.
Oh, man.
that we dread, don't love,
Right.
but do it because it
Mhm.
literally can save your life.
Right.
Listen,
so
I'm
that's it.
Listen, I'm a guy. I'm going to say this as a guy.
Mm-hmm.
We have got to figure out a better way than mammograms. That is the meanest idea of a machine and,
Right.
and a test. And I'm like,
Yes.
it is terrifying to me and horrifically painful. And every woman deserves a hug from somebody they love the minute they come out of that.
Well, think
Like,
about this.
oof,
when they
horrible.
do the mammogram and then they say, "Oh, we need to get some more images," and then you got to go through the process.
It's the
again.
holding your breath though. When you
Yes.
take a picture. Like,
Yes.
I'm like,
Yes.
you guys haven't evolved from this yet. Like,
Yes.
why?
We have to have better technology.
Yeah,
Listen,
better technology. Yes.
I'm going to say this. If you had to squish the male anatomy in between two panes of things,
Y'all wouldn't be able to take
No.
it.
hell
we would have
no.
found
Oh,
it.
no.
I'm gonna tell you right now,
That's
we
a-
would have
that's
found a
a
different
hell
way.
to the
So
no
I'm
right
just
there.
trying to figure out some doctor somewhere. Somebody figured this out. 'Cause there is no way we should
No,
be smashing things.
couldn't.
Like
No.
there's no way.
No.
I feel so and does not matter your size, your shape, your style, whatever. It is the most painful, and it has to happen all the time. I'm like,
Yeah.
we got to come up with a better
Yeah.
way. There's
Well,
got to
think
be a
about
better
women
way.
in GYN exams. Like,
Listen.
we go through it all.
We
Listen,
really do.
We really do.
I'm going to tell you right now, as the one male in
Yes.
the
I
room,
wanna hear
Dr.
that.
Drew, come back. I could have used some help and some backup here, Dr. Drew. But what I'm just going to say is, yes, you do, and bless women, because without you, there would be, because I'm going to tell you, if men had to give birth or men had to go through some of these things,
It would be
this species would be over.
extinct.
We would have been extinct a long time ago. I'm just telling you, it's not going to happen, because guys would be like,
gosh, yeah.
no,
Oh,
no, even C-section, right?
Yeah.
People act like, oh, C-section's no big deal. It's a lot bigger deal. Like, have a guy have to do that a few times and then ask him to have another one. I don't think
I'm
it's
gonna
gonna
get OBGYN on here because I want to have a conversation actually about that. So
Yeah.
I
Yes.
think
Well,
I'm
we
gonna-
did have one.
No, but I'm saying, I want to have
Another we did have one.
yeah, we did have a
Yeah.
We didn't
yeah.
talk about. I know we talked about menopause,
Right.
but I really
right.
want to get into the semantics of like
Yeah, having a
childbirth
baby.
and
Ooh.
having
Yeah.
a baby, because that's a big one. So if
Yes.
anybody's listening and you want to be
Yeah.
on the show, I want to talk about childbirth because
Right.
it's still a controversy right now. We
Mhm.
can get into it, but I don't want to right
No,
now.
we'll have
But
to
we'll
save that for another
Save it
one.
for another
Right.
day, but
Yeah.
it's something that I want to discuss. So
But
anyway.
we need to we can have some more medical professionals on
Yeah.
so they can, contact us and
But
we
yeah.
can get some more topics in because there's a lot to talk about.
There's a lot to talk about.
There is a lot. So
I just want to say before we get off,
Mm-hmm.
how's 12-year-old you doing over there? Because you were absolutely, because in our generation,
That was the
he kind of
MTV was-
is the voice
Yes.
of kind of openness and open sexual
Yeah.
conversation. Like, Loveline was a transitional,
huge.
like, I remember working in media. He and I came through this period of the late 80s, early 90s with AIDS epidemic and all this stuff. We were exposed to stuff, and then there was only so much you could say. And
course.
they really pushed, I mean, he and Adam Carolla
No, I
really
loved it.
pushed the line
Yep.
of what people were hearing and seeing. And I
Mhm.
think it's so important because I think in a lot of ways we've gone backwards. And we're so worried about what people hear and censoring this and, oh, our kids are hearing too much. I mean, you mentioned being a middle school kid. I was pretty young too, and I was sitting there laughing when you said it because I'm thinking, yeah, but these are the voices who were giving you honest
Mhm.
opinions.
Yeah, I was really intrigued by it. I
No
never
one
listened to it
else
on the
was.
radio, but I
Yeah.
did watch it when it was MTV because it was the MTV culture then for sure. So
that was definitely a great show.
it was a great show.
Yeah.
Did
So
12-year-old you get what you wanted?
Yeah,
Yeah.
definitely 100%. No, I think it was great, and I hope I hope he comes back. So anyway, everyone, thank you so much
Thank
for listening,
you.
watching, tuning in again.
and we want to thank our
Subs-
other guests that's been on the show to
Yes.
help support us. So we definitely want
Yeah.
to say thank you to them.
And don't forget to subscribe to our YouTube channel,
Yes.
officiallovesick.com.
And that's it.
That's it.
Thank
See you later.
Bye.